from the News Channel 5 network. This is Titans Tuesday.
We welcome you in on this Tuesday night, everybody. I'm Hope Hines. Glad to have you with us. And tonight, it is Titans Tuesday. Our special guest is middle linebacker Stephen Tulloch of the Tennessee Titans. Stephen will be along a little bit later on. First up, though, we're going to get into some things that have to do with broken bones and muscles and tissue and sinew and that sort of thing. And for his second appearance, Dr. Blake Garside is here, brought to you, of course, as always, by Baptist Sports Medicine. So let's say hello to the good doctor. Blake, good to have you here, sir.
Thank you.
Well, and you're back for the second time around, so we appreciate you being here again. And of course, your presence is being brought to you tonight by Baptist Sports Medicine. Now, before we get into anything else, let's just when I went to shake Blake's hand tonight, he said, "Now let me please caution you, shake my hand gently. I've just had surgery on my hand." So our viewers would like to know what kind of surgery, and did you perform that yourself?
No, I didn't perform it myself. I had one of my partners at Tennessee Orthopedic Alliance perform it. I had a carpal tunnel release.
Now, a lot of us have heard that. I've heard of that, but what is that?
Carpal tunnel syndrome is compression of your median nerve, and that's the nerve that provides sensation to your thumb, your index finger, your middle finger, and half of your ring finger. And I'd had several years of waking up at night, which people commonly do, feeling that your hand's asleep, trying to shake it out, and horn splints, and then finally decided I had enough waking up and had it released.
Now, did that only happen at night?
Yeah, it would happen at night, or sometimes if I was riding a bike or exercising, sometimes I'd get
never when you were operating. Never when you were operating.
Never happens when I was operating. Still doesn't happen when I operate, but it was, feels a lot better now.
And it's a fairly common procedure and a problem, I guess.
Very, very common procedure. Very common finding, more common in people that do a lot of. We used to associate with a lot of typing, a lot of industrial type jobs, or using your hands.
Piano players, perhaps, or people who play instruments, or musicians, maybe.
Some musicians, more people working industrial jobs or on the line. Let's say with it's considered an overuse type syndrome.
Good. Well, are you a good patient?
I'm not the best patient. Haven't been as compliant as she'd like me to be.
Doctors, now you can appreciate the other side of it.
I can. I definitely can.
Yeah, I know it. I know it. Well, we're glad you're all in one piece and things are going well for you.
Thank you.
So, there's you guys are normally here to talk about injuries with the Titans, but we don't. I say we don't. They don't have very many injuries right now that apply to your line of work, so to speak. But there are enough injuries around the league that are going on. The knee injuries, the hand injuries, the pinky finger. Derek Anderson there with the problem in the finger. And I guess for a quarterback, when that happens, I mean, you're really all messed up.
Yeah, I mean, it's
no way to just tape it to two fingers.
I think with Brady Quinn's injury, it was more of an index. His was on his index finger, so actually grabbing and holding the ball, and was I think. In reading, he actually displaced his fracture, so it needed to have surgery to really stabilize it. That made it for a quarterback, you think of every time. If it was on his his non-throwing hand, maybe his little finger, he'd probably have a better chance of being able to play. But on your throwing hand and your index finger where you grasp the ball, which also controls your spin, that's going to make it much more difficult.
And I guess with all injuries, Blake, here again, it depends on the individual. Some people just heal faster. Some people, can do more things when they're injured than other people can. Oftentimes, a lot of it's up here, isn't it?
Right, and there's a wide variation in your pain tolerance and what you're able to tolerate. Some patients are going to be able to tolerate a lot more pain, be able to do things a lot quicker. Others will take more time out. They are more limited and are going to take a longer time to get back to doing what they need to do.
When you operate on somebody, no matter what it may be, finger, knee, joint, shoulder, whatever it may be, ankle, foot, are you concerned about the psychological makeup of your patients, or does that really not even enter into it? I mean, you're going to put them to sleep, or you're going to numb whatever it is you're going to operate on, so you're not, I guess, really having to deal with that. But you talked about pain tolerance a moment ago. Is that something you like to know about before you operate on somebody?
Yeah, you want want to have a good understanding of pain tolerance, and a lot of patients who think that they have a very high pain tolerance
really don't.
Right, they protest a little bit too much.
Right,
but I mean, you want to know that because it's going to be especially important in the rehab, and knowing how, telling the patient, well, how far they can push through, what discomfort they should expect, what you don't want to go to no pain, no gain, but you really, some patients you have to couch them, okay, this is healed, everything's stable, this is what I really want you to do as far as moving your shoulder, your knee, and what you can tolerate, and you're not going to damage what I've fixed.
For people who are not professional athletes, such as Stephen Tulloch, who will be coming up here a little bit, let's take runners and joggers, for instance. If you pound that pavement over the years, you're going to wear those knees out, aren't you?
Typically, you're going to have...
Most people are?
You will have some knee pain. Yes, you'll have some knee...
you'll have meniscus, you'll have ligament, you'll have cartilage, you'll have a lot of things. Knee replacement? Kneecap
arthritis. Some patients will go on to knee arthritis needing a knee replacement. Depends on what, how many injuries they've had in the past. But
so is there anything you do to, I guess the only thing to prevent that is just good shoes. Make sure you got good, but if you're going to run, you're going to run.
Frequent changing. Yeah, frequent changing of your shoes.
Okay. I got a pair of one for 8 years.
Yeah, you probably...
I love them because they just molded onto my foot.
Probably not the best, most support and aren't going to help you the best with running.
I agree.
Frequent changing, you want to maybe cross-train, maybe not run all the time, and use bike, swim, do something that's going to use some of the other muscles and less pounding on your knees or in one particular joint.
Right.
And
just
treadmill's
use good common sense, right?
More common sense will get you by a long way.
Warm up before you do it.
Warm up and actually stretch. There's a little controvery about how much stretching you should do right now. Before, I'm still a firm believer. Most runners don't stretch enough. Most people have a limited amount of time, and they say, okay, I'm going to go out. I've got 30 minutes to run. They go straight to running. Well, they're the ones who are going to develop. They're going to have the hamstring problems. They're going to have the quad problems. They're going to have pain, more prone to some overuse injuries.
You are a golfer.
Yes.
And a very good golfer. You played golf in college.
I did.
So you should be good. But here's the question. There are a lot of us that play golf. How many golf-related injuries do you ever see? I mean, not just in golf itself, but maybe as a byproduct of something else going on in someone's life, right?
Yeah. Yeah, you see more problems with...
Now, hey, I can hit the ground real hard, and I can break my wrist, or really and truly, I mean, I've seen guys, I've done it before on occasion, you just hit the ball so fat, man, it just jars every bone in your body.
But you'll see patients that, you'll actually see people that have, will tear a meniscus, or they'll play on, golf is played on uneven ground.
Right.
I mean, you're on terrains that are varying, and they go down, they'll notice more pain when they go down to line up a putt, or they notice that they've stopped lining the putt up because they can't, they hurt their knee when they do it. Or you see people, if they played a lot, they're going to develop lower back problems, and that's where it really gets to develop, developing your core. And you see a guy like Fred Couples who's hit thousands of balls, or a lot of people who played a lot that aren't really strengthening their core, strengthening their back muscles enough, and they probably need to.
What is, in your profession, not only you, but all of the doctors that you associate with, and your group again is?
Tennessee Orthopedic Alliance.
What is the toughest operation for you to attempt?
We have
most complicated, I guess.
And the spine surgeons would say that the spine surgery is probably the most complicated. One that's fraught with the patients are in the hospital a little bit longer. I think the most painful that I perform and some of my partners perform is probably a knee replacement. Okay. It's the most beneficial from the standpoint of getting you back to functioning and doing things, but those first 4 to 6 weeks are extremely painful, and you got to learn to bend your knee again, learn to regain your motion, walk again, and it's very painful at the beginning.
Well, you guys perform some wonderful things for the rest of us out there that need your services from time to time. Continue to do it. Blake, thank you so much. Dr. Blake Garside, brought to you by Baptist Sports Medicine. And if the season lasts long enough and they go to the Super Bowl, maybe we'll have you back again.
Keep every time I come, there are no injuries, so that's a good omen.
There you go. Thank you very much. Appreciate it. All right, we're going to take a break. We will come back. Middle linebacker Stephen Tulloch will be our special guest. And you on the phone. We're back right after this.
Titans Tuesday, brought to you by Baptist Sports Medicine.
It's time to put an end to living on the sideline. With joint replacement, the experts at St. Thomas Health Services can get armchair athletes into the game.
Honey, what are you doing? Please don't do this to me. Please.
Life isn't a spectator sport, so jump back in. Visit sths.com.